Sure. So hello everyone, hope you can hear me. My name is Geraldine Munn-Mace and I'm a paediatric nurse, and I've recently returned from my first mission with MSF. I was kindly invited to talk today a little bit about my sort of education and my career pathway, also what led me to work for MSF, how I sort of got there, and also a little bit about my first mission with MSF and what it felt like. So that's sort of what I'll be talking to you about today. So next slide, please. So I understand that most of you are medics, so my sort of education pathway is a little bit unusual, a little bit different. I actually did a degree in politics, languages and international studies at the University of Bath. But as with many of you, I was always very interested in the humanitarian aid sector. I was always very much sort of involved with different groups. I was part of the Amnesty International Society, and I also always chose modules in global governance or politics in developing countries, things like that. Once I graduated, I basically decided I wanted a bit more of a hands-on role in the sector. And there's many ways that you can do that, obviously, but I decided that I wanted a very sort of direct way into being a bit more hands-on. So I chose that summer after graduating from Bath that I wanted to become a nurse. So I applied for the postgraduate diploma in child nursing at City University of London. It's a fast track course, so instead of the 3 years, everything is condensed into 2 years and three months, the 3 months being your elective placement. So that's sort of how I chose to go into the humanitarian aid sector. Next slide, please. So what led me to work specifically for MSF over other humanitarian aid organizations? So it really felt like the perfect fit for me. I really thought that it combined my passion for politics, my passion for international relations, for languages. I studied Spanish and French. It also basically combined my upbringing as well, because I was exposed to many different cultures, and also this sort of, I wanted to help others in greater need than myself. So MSF was just sort of the perfect fit for me with my background, with my degree, and also with my new sort of nursing degree. I had heard quite a lot about MSF growing up, so it was always on my radar. It was always an organization that seemed sort of an amazing organization to work with. That's mainly because my parents were living in Ethiopia during the 80s, and I'm sure you're all aware of the huge famine crisis there during the 80s. So I heard quite a lot about it then. MSF was doing a lot of work there, and I also grew up in Pakistan, where MSF was doing work at the time, and it's still working there. So it was always on my radar, always an organization that I knew about. I did a lot more research on it because I thought, okay, if I'm going to be sort of tailoring my career towards this organization, I want to know a lot more about it. So what really drew me and what really led me to work for MSF is that I was so drawn by the fact that MSF is completely impartial, it's neutral, and it's not associated with any government. And that really was quite a huge factor for me. Another factor is that the funds that MSF gets, so 90% of its funds come from private donors, so it's got a huge flexibility and can really act immediately when an emergency is out in the world. So it can really go quite quickly because it's not tied to any government or not tied to anything. So with those factors, I started my journey to become an MSF nurse, essentially, and I went straight onto the website. I looked at the requirements of what MSF wanted in their health professionals, and I basically started tailoring my career towards that. So next slide, please. So as part of my elective placement, I volunteered in a hospital in Ethiopia. It was a hospital near Gambela, which is near the South Sudan border. That was a hugely enriching experience, very eye-opening. It really showed the challenges that developing countries face in their health systems. So I was there for 3 months. I started my career as a nurse on the paediatric short stay unit at the Royal London Hospital here in East London. I chose that area specifically because it is basically a step up from A&E. So you are exposed to many different conditions, many different specialities. So it's a multidisciplinary team always. So I was exposed from anything from orthopedics to hematology to oncology to respiratory conditions, and it really set an incredible sort of like groundwork for me in terms of acquiring knowledge in all these different conditions and illnesses. It was also extremely fast-paced environment, so there was a huge turnover of patients. So it was a really great place to start working as a nurse. While I was doing that, in my first year of qualifying as a nurse, I also continued my education. I always had global health in the back of my mind. I always had MSF in the back of my mind. So my master's in child health, I really tailored it to global health, and I wrote my dissertation on TB treatment in complex emergencies. So I was sort of trying to gain more knowledge on those sorts of conditions and that area as well. After the pediatric short stay unit, I basically wanted to specialize in something as a pediatric nurse. So I moved to the Evelina London Children's Hospital, which is part of the Guy's and St. Thomas Trust. So I worked on the pediatric intensive care unit, which was an incredible experience. And also it really obviously taught me a lot on how to care for the critically ill patient and how to manage that and how to manage the stress of working in a very high pressured environment. So I was there, and while I was working on the intensive care unit, I also did my diploma in tropical nursing at the London School of Hygiene and Tropical Medicine, which is an incredible school. I completely recommend any courses there, any diplomas. It was absolutely incredible. You meet like-minded people, and you also get taught by the most incredible lecturers who have so much experience. I also wanted to develop my teaching and my capacity building skills. So I was also at the same time as working on the intensive care unit, I was a visiting lecturer at City University of London for the modules of critical care. And I also assisted with many simulated practice modules. So I really encourage any sort of teaching skills, like throughout your degree, throughout your courses, to try to get involved with that. So once I did all of this, once I had sort of my experience on the ward, my specialities, my diploma and the teaching, I felt that I was ready to apply for MSF. I felt that I had the necessary skills and requirements that would make me a valuable member of the team, because I didn't just want to go on an MSF sort of mission as an adventurer. I really wanted to take something with me to have a valuable skill set. So I applied for MSF as a nurse, and so next slide, please. I was matched with my first project, which was in Sierra Leone. So very briefly, I'll just talk to you about why MSF is there. So it was a capacity building project. So we worked alongside the Ministry of Health. So it wasn't just an MSF project. We were working with staff from the Ministry of Health and representatives from the Ministry of Health. And it was a maternal and child health project. The reason why it was very specific is because Sierra Leone basically has the highest maternal mortality rate in the world and the 5th highest mortality rate in children under 5. So it's really been struggling to rebuild its health system since there was a civil war for 10 years during the 90s and the early 2000s, and also obviously the Ebola outbreak from 2014 to 2016. So it's really struggling to rebuild its health systems. Really briefly, our project was divided into two. So it was one project, but we had 2 teams in 2 locations. So we had one team which was in the Mabraka town. So they were part of a team who were working in a secondary health facility, so a hospital. And then we had the team that I was part of, which was the Mile 91 outreach team. We were actually in a village called Mile 91 because it was 91 miles away from Freetown, which is the capital. So we were the outreach team, and we supported and managed 8 primary health facilities and 7 malaria treatment health posts. If you see the picture there, that's just one of our health facilities. That's sort of the size of them, and roughly each health facility would see probably about 300 to 500 patients under 5s every month. One of the health facilities, which was sort of our referral centre, before going to the hospital, saw about 1,500 children under 5 every month. So we would work very closely with our team in Mabaraka. We would refer critical ill patients there, which was about a 3 to 4 hour drive away, depending whether it was the dry season or the rainy season. So yeah, next slide, please. So yeah, that's our team. So my role was a nursing activity manager. I was there for 10 months from late September to July. And that's basically just a photo of our team. That's the international staff. That's the day that we got let out of quarantine. Basically, we had to quarantine for 2 weeks because we had a couple of positive cases of COVID-19 within our staff. So that was the day we all came out. So we've got from left to right, we have the midwife from Kenya. Then we have the medical team lead from DRC, the other nursing activity manager from Ethiopia, myself, and the project coordinator from Italy. So we are a very diverse group, quite a small group. Normally, they're much bigger teams in terms of the international staff. So my main responsibilities were to sort of supervise and manage 4 of the primary health facilities, the 7 malaria treatment health posts, and also staff health. There was a lot of organising joint supervisions with the Ministry of Health representatives. So we would visit each of the health facilities to see what the challenges were, to see what was being done in a positive way, what needed to be worked on, what the action points of that was. So we would work together with the Ministry of Health. We also had to write monthly medical reports, so always analysing our data and our trends, trying to figure out why was there an increase in acute water diarrhea suddenly? Why was that happening around this area? Or why was there a decrease in patients suddenly? What was going on in that community? So that was part of a monthly report. It was a capacity building project, so we did a lot of training. That was my main responsibility, as it were, was doing a lot of training. The sort of guidelines are called Integrated Management of Childhood Illnesses, and we also did a lot of training in terms of referrals of patients with severe complicated cases to our secondary case facilities and how to make that a smoother process. And quite a big part of the job was actually medical supply management. So I was also nurse/pharmacist, so there was a lot of making sure that every facility had enough drug supply, had enough medical items, doing lots of orderings, lots of time spent on Excel spreadsheets doing those. So that was sort of my main responsibilities. So next slide, please.
Geraldine?
Yes.
You've got 5 minutes.
Okay, sorry. Sorry about that. So I just wanted to show you a couple of pictures, just so you sort of understand, sort of to get a picture of what it was like. That was our walk from the office back home. Just imagine yourself in sort of 90% humidity as well. That was about a 20-minute walk back and forth from the office to home. So yeah, next slide, please. That was the entrance to the MSF office there on the left. That would get very, very muddy during the rainy season. Yeah, that's just the entrance of our office. So next slide, please. That is just on our way to one of our health facilities. Sometimes the roads were not great and we'd have these sort of logs and bridges that we had to manage to get through. Yeah, we all sort of get off the car to walk across them or whatever, things like that. Yeah, next slide, please. I won't go into detail of this, but I was sort of asked to talk about a day in a nursing activity manager's life, and basically the thing that made it incredibly interesting, incredibly fulfilling, was that no day was the same. No day was the same at all. Like, you could get days when you were in the house facility all day trying to manage a critical patient, or you could get a day when you had to be in the office writing medical reports, or ordering supplies, ordering medication, or go on to outreach, hold meetings with the Ministry of Health staff. There was a lot of variation, and that's what made the job incredibly interesting. There was a lot of different types of work that had to be done. So I learned a lot about logistics and water and sanitation, which you'll know that the medical team and the logistics team are always talking back and forth about what they can do to improve the house facilities, things like that. So incredibly varied. So next slide, please. Sorry. So yeah, just as I said, that's just another picture of some of the road conditions. We'd go home and normally all sort of eat together. There was not a huge variety of food. We just had a lot of chicken and rice. It was a lot of fun because it was nice. We were a small group, so we'd sort of got on and stuff. And then, yeah, it's basically a 24/7 responsibility job. So I would get called at any time of the evening, of the night, if there was a critical patient that needed to be referred or seen, or if there was a member of staff who's not feeling well. And this obviously increased quite a lot with the COVID-19 situation. And next slide, please. That's just our home. And at the weekend, we would put sort of a volleyball net between two cars and have volleyball matches, and also get the guards and the drivers involved. So just have a little bit of downtime, a bit of exercise as well. Next slide, please. Very quickly, but Pam, if I don't have time, that's fine. I don't have to go.
No, that's okay. Go ahead. It's really interesting. Go for it.
So I just thought very briefly, I would just talk about how COVID-19 sort of impacted our work as sort of individuals, but also as our team. So basically, there was a lot of uncertainty. The international airport closed on the 22nd of March. And we essentially, as a team, had about 10 to 15 minutes to decide, because the government only announced that the airport was closing on the 21st of March. So we had about 10-15 minutes to decide whether we wanted to leave Sierra Leone, leave the country on the last flight out of the country, or whether we wanted to stay in the country and not really know when we would be leaving next, because we had no idea about the situation. We had no idea when the airports would close again. So it was quite stressful on the team. We actually all decided to stay without knowing when it would open. And actually the airport didn't open for another 4 months. And we all had to so we had to stay in Sierra Leone and not go sort of home for our leave or anything like that. But also it meant that end of missions were prolonged. So my mission was meant to be 9 months, but it actually ended up being 10 months. So things like that, there was quite a lot of uncertainty. What really struck me was the community memory as well, because obviously the communities went through such a awful time with Ebola, and it really brought back memories of that for our communities, but also for our MSF national staff. And you could really tell that there was a lot of fear, a lot of anxiety around it, because the only thing that they could really relate to was the Ebola outbreak. So there was a lot of comparing, and it was really interesting to be there and to see just how it affected our communities, but also it really affected the fact that there was a huge decrease in numbers of patients coming into our facilities, and we really had to work hard with health promotion to get people to come back to the health facilities. That was a huge problem of ours while we were there. Also, there was a lot of quarantine and treatment centres being put up around the countries, which MSF helped with a lot. But also it meant that a lot of the MSF staff, a lot of the Ministry of Health staff, so this is health professional staff, were admitted into treatment centres. So there were MSF staff who got COVID-19, who had to go into treatment centres. International staff also had to go into treatment centres. So it just decreased our workforce quite substantially for quite a for a couple of months at least, trying to figure out how to best work with that and learning to cope with two agendas. So we had all our normal activities, all the activities that I was sort of talking to you about, but we also were preparing for COVID-19. So we had to make proposals for all our isolation tents. We did a lot of training of staff for PPE, for, training the community as well. There was a lot of health promotion. So it really was quite a difficult time trying to manage both agendas, as it were. And that's it really from me. Next slide. And yeah, that's just one of the house facilities. It was a house facility called Bakiloko, and that's the team that were working at the house facility. And that's us all preparing for COVID-19 with our masks. Thank you very much.
Thank you so much, Geraldine. That's really, really interesting, a really detailed and interesting picture of what it's like to be a nurse on a first mission for MSF in the field. And it sounds like it was a really good project. So that's brilliant. If anyone has any questions, we'll try and take some questions at the end if we have time. Otherwise, yeah, just type them in the chat. So thank you so much, Geraldine. If you now unmute, I'm going to hand over to Abdu, our second speaker from the field, who is calling us from Iraq. And Abdu, you are okay to share your screen for your slides? You want to unmute yourself?
Hello, Pam. Yes, all is ready.
Okay, great. So we'll have Abdu and then we'll have Mark as our third speaker afterwards. So take it away, Abdu.
Hello, everyone. Let me just start sharing my screen with you so that we can start having a glance from the field.
I can see that perfectly, Abdu.
So just before I start, I would like to ask you a favor and to go to your top of your screens and to your view options. Please select the side-by-side mode so that you can see me as much as you can see my presentation. So, hi all, hello, marhaba. My name is Abdu Rahman. Oops, that's me. And you may call me Abdu. I help people in the project to get their requests by delivering goods or services in a specific timing. That's me being supply chain officer. I've been with MSF for 3 years now, working at MSF Holland, Iraq Mission Kirkuk project. Let's take a deeper look at the last sentence. Iraq, Kirkuk. I'm sure you all know where Iraq is, and Kirkuk, well, Kirkuk is distinguished with many things. It is the 4th largest governorate in Iraq, population-wise. According to the estimates of 2017, the population exceeded 1,259,000. It is also a city of enormously diverse population. That includes Iraqi Turkmen, Kurds, Arabs, and Assyrians. It is an important oil field with a big oil reserves. It is also considered as a cultural capital with a citadel built 4,000 years ago. Still, it is one of the disputed areas between Iraqi government and Kurdistan region. Speaking of Kirkuk, it's the city I grew up in. After high school, I went to College of Administration and Economics, studied Department of Statistics. Of course, not by choice, because few things are by choice in Iraq. After graduation, I remember having only a break of 10 days before I start my next job. So I started working as an accountant in a wholesale shop of drinkings like water, juice, soda. 6 months later, I started a second job as a storekeeper in a clothing brand company. With another 6 months, I was selected for a section manager trainee. It was getting a bit too much, so I had to quit my first job. And then, after doing a manager's job for a year there, they kept us as trainees. So I had to decide and quit, and that was when I joined MSF. I started as a storekeeper with MSF, for a year and a half before I became supply chain officer. I learned a lot and enjoyed my job. I also got engaged with MSF life in the field and MSF debates. At the end of my first year, I got the chance to represent Iraq mission on an annual event of MSF. It was held in Amsterdam and called the OCA Cafe. That is Operation Center Amsterdam Cafe, where I had the chance to see more about MSF in many different aspects. It was also the time when I actually believed in MSF's true value. And of course, I met Pam. So what do I do? Normally, requesters think of us as Santa Claus. Exactly, by making a long request of items and expect to get them the next day and put dates off as soon as possible all over them. And they expect us to be always available. Well, what we actually do? So supply chain starts with a need and should end up by fulfilling that need. We are responsible for getting almost every item in the whole project, whether directly or indirectly, by requests. We manage both medical needs like drugs, treatments, and also cold chain items and lab tests, of course, alongside with medical equipment and supplies. Oh, that's the medical warehouse when I was still a storekeeper. Looks nice, huh? We also manage logistical needs. That's like stationery, printing, cleaning items, and also furniture. It can also be getting over 2,000 water jerry cans for a village to get access to clean water, or sometimes to find oxygen cylinders in the times of COVID, which is very difficult, by the way. Those in supply chain know the impossible is possible. Have you ever heard that? We may be a small department, yet we are the beating heart that pumps goods and services into the project to make it run properly. The most simple way of explaining a request cycle would be that a requester comes with a request and then processed by supply chain officer. Then this request will be purchased by the purchaser officer and get paid for by the finance from the admin department, and then received and checked by the storekeeper to be delivered to the requester again. We manage a warehouse and we ensure everything is organized and tidy. Oops, abracadabra. Yeah, that looks better. We also take care of cold chain items and monitor temperature and also report any breach. Oops, again, abracadabra. Yeah. So we do know some magic after all. To be on supply team, you need to be really organized, good with Excel, because you will be dealing with Excel a lot. And sometimes, well, most of the times, you need to think outside of the box. Also, you have to have a reference for everything, because you will be asked afterwards. And you have to love numbers. It is really great and challenging in a good way, and you'll never get bored. Well, where does all this go? What happens to all these items? As MSF Charter states, we deliver emergency aid to people affected by armed conflict, epidemics, exclusion from healthcare, and natural disasters, which is the case in Hawija district that is located 55 kilometers south of Kirkuk. It was occupied by ISIS from 2014 until October 2017, leading to almost complete infrastructure destruction of the area, where accessing healthcare is a daily challenge. Adding to it, the pandemic of COVID and other epidemics. Before liberation, MSF was there also at the checkpoints, treating wounded IDPs. Those are internally displaced people who were fleeing to the city, and giving medical care until they were moved to the camps. Putting access challenge aside, we also have the difficulty sometimes with the tribal context, which makes it a bit difficult. Now we treat thousands of NCDs, that is non-communicable disease patients, and also thousands of consultations for SRH, that's sexual and reproductive health. And we support the ER and maternity in the hospital by giving trainings and also support the management in the hospital, and we also give donations. We also provide mental health support and sexual and gender-based violence services. And we also have health promotion teams going around and sharing awareness. We always try to support those who need medical care and cannot get it. All this is only a glance, as I am nothing but one person from one project in one mission. Add to it, this is one side of the story, the caregiver. What about the other side? You will find out when you hit the field. Thank you all.
Thank you so much, Abdu. That was really great. Yes, and also, yeah, first of all, great to have a talk live from Iraq. That's definitely a first for a student event. And that, I have to say, is some of the best PowerPoint animation I've seen in a long time. I want to learn how you do those.
Thank you, Pam. Thank you very much.
I love the magic wand. I need to up my PowerPoint game, clearly. Right, so next we have, oh, sorry, I thought my video was on. Next we have Mark Sherlock, who is our doctor for today. So greetings, Mark.
Hi, Pam.
Can I just test we can hear you?
Okay?
Yes, yeah, I think it needs to speak up a tiny bit. But,
can you hear me better?
yeah. Now, Charlotte should be sharing your slides any moment now. So if you just bear with us while we get back to that, and then we'll take it away. Just to say that we'll hope to take some questions for all three speakers at the end if we have time. And if we don't have time during the actual timetabled session, then if you, the three speakers, just hang on and see if there's any questions in the chat after the session when we go into the break. Right, welcome Mark, and I'll leave you to take it away.
Thanks, Pam, and if you have any trouble hearing me, just come up and give me a shout. Also apologise for missing the start. I had a time zone challenge in my head, so I was a few minutes late. So sorry about that, Pam. Nice to be here, nice to see so many people connected on a Saturday morning for this talk. So as Pam said, I am a doctor. And for this presentation, I want to go through a little bit about on my experience as working as a doctor for MSF, and also the career possibilities that you have within an organization like MSF, which goes beyond maybe just say doing an isolated mission. So I'll just give a bit of a background on me and what I did, and I'll explain a few stories along the way. I started my kind of university education. I did a degree in natural science in Trinity College in Dublin, where I graduated in 2007, and I then ended up doing graduate entry medicine, 2 years between Swansea and 2 years between Cardiff, and I graduated in 2013. And then over the next few years, I also undertook a diploma in tropical medicine in Liverpool, did my membership exams for the Royal College of Physicians, and then have just finalized a master's in public health. So I have been in a cycle of education for the last quite a long time, and hopefully this is the end of it now. But it goes on for quite a while sometimes in medicine, as you know, and but you don't have to rush through everything as well, which is an important point. But it's important to know what do you need, what qualifications do you actually have to get a job as a doctor with MSF. And can we go on to the next slide, please, Charlotte? So I've kind of used the same timeline, but I just wanted to go through kind of what is actually needed. And you see a kind of grayed out the primary degree, of course, not a medical degree, understandably. And then you need to have worked for about 3 years clinical experience. So in the UK, that would be the foundation program plus at least another year. In Ireland, for the Irish students, would be your internship and then possibly like BST or some kind of core medical training after that. The guidelines are a little bit more grey in terms of what you need, whether you need a diploma in tropical medicine. When I originally applied, you did. But I know for some positions you may or may not. I do think this is a useful qualification. And you can do it in a variety of locations, and you don't have to do it actually in the UK. And of course, there's amazing UK options in London and Liverpool, Glasgow, Sheffield, but also you can do it in Antwerp in Belgium, the East Africa Tropical Medical Diploma in run through the London School, but based in Uganda and Tanzania. In Peru, and there's a very good course. But also there's a few other ones around the world. And this diploma actually, because as a doctor and the countries that we work in, the 73 countries that we work in MSF, most of them are in tropical locations, which means the medicine that you'll come across will be different to what you've been trained in the UK or Ireland. So in order to prepare you for that and the wide variety of pathology and disease that you will see, a diploma in tropical medicine can be very useful. So what I did that in 2015 after my foundation program, and then continued to work for a little while before I joined MSF itself. Next slide, Charlotte. So just focusing in a little bit on my career, because when I was at your stage, from the student's perspective, which is not very long ago, I used to hear a lot of kind of stories about what the job entailed, but I was never given a clear outline of actually what people did to get to that point. Because I always went to talks and saying I'd love to do what they do or what they did, but I never really knew how to navigate it. And there's no kind of clear way, but I will outline what I did. So my career in global health actually started before medical school and after my primary degree in science and natural science, where I worked as a malaria researcher. And that took me to Tanzania, Belize, Thailand, and Peru. This continued throughout medical school as well, and where I did a little bit more remotely. And Cardiff Medical School was very flexible for me to take some time off during medical training to actually do a little bit of this on the side as well. And from there, when I graduated medical school, I did a foundation program in Liverpool. I did the academic foundation program, and that was in infectious disease and tropical medicine, which allowed me to go to Malawi as well during F2 for one of my blocks. However, I've blanked out the academic part because when I was at the end of kind of med school, I thought, you know, you have to be in an academic program to get into kind of these kind of global health career paths. That is not the case at all on hindsight. And just doing the foundation program, wherever that may be, in a remote location in Scotland or London, wherever that may be, and the same would work in Ireland, it doesn't really matter where you do it, it's just as long as you do it. Because the skills that you will gain from that 2-year program will be the same if you did it, no matter where you did it in the UK or Ireland. So after that, as I said before, I did my diploma in tropical medicine, and then I went to Darwin in Australia, which is working very much in Aboriginal health in the Northern Territory. And I did that for 6 months before coming back and finalising my MRCP exams. And then I worked in the remote location in Scotland in Orkney. So a very small 30-bed inpatient unit in Scotland, where you had to be a bit of a jack of all trades. And that prepared me actually very well, considering it was still part of a UK context. It did prepare me very well for MSF, because in Orkney, you had to think on your feet and you had to be a bit of everything. And there's no kind of specialist in your immediate vicinity. So you had to be able to think outside the box. And this experience lined me up quite well towards the end of 2016 when I joined MSF and actually went on my first mission. So next slide, Charlotte. So my MSF career then has passed from 2016 up until now. And in the next 2 slides after this in a second, I will go through some pictures and some stories, but I just wanted to outline what this career in MSF for me has looked like. So I started in Kenya in a multi-drug resistant TB and a HIV project in Nairobi. And then this was followed up by working as a hospital director. So running a 300-bed pediatric and maternity hospital in rural South Sudan. This was followed up in 2018. I went to Afghanistan, specifically to Herat in the west of Afghanistan. We were trying to set up a new project in an emergency medical department, but also doing an intervention and setting up an intervention in an internally displaced camp, IDP camp, of 100,000 people in Afghanistan. And I'll come back to that in a second. And this was followed up by a mission coordinating our activities in Malawi, of which was a very large HIV project in rural Malawi in Chirud Zulu. And this has led me now to actually taking this into beyond kind of the medical programming side into a wider public health and strategy capacity. And I work as a health advisor. So this is a health program manager position. So I work in the Amsterdam headquarters for MSF. And in this position, I cover Iraq, Jordan, and Nigeria. So I am kind of responsible for the medical strategy in each of these countries, and as we go forward over the coming years. But it's also important to point out that you can do all of this MSF career, but you can't keep a career in the NHS or in the HSE in Ireland. And throughout this whole period, I've continued to work as a middle grade doctor in emergency medicine. So there's a lot of preconceptions that you can when you go into a global health career and you actually go into it hands-on full time, you have to give up on your doctoring, hands-on doctoring career. That is not the case. With a bit of flexibility and finding the right hospital, say in the UK or Ireland, and for me, I mostly do that in Northern Ireland in a hospital in Enniskillen. You actually can put together a very flexible career path. And MSF in my HQ position are actually very flexible in giving me the time to actually continue to work as a doctor on a frequent basis. So I just want to go through a little bit on the missions that I worked in. So I'll go to the next slide, Charlotte. So in the top 2 pictures, you see the one of the MSF logo and then the one of me with 2 of our patients. This is for my first mission, and I've got permission from any of the patients that you see in these pictures. I've got permission actually from them to be shown externally. And this is for my first mission, the top 2 pictures beside each other, and that's from the HIV, multi-drug resistant HIV program. And the two people that you see in the picture with me, their names are Evelyn and John. And these are 2 patients who were suffering from extensive drug resistant TB. So this is TB that no other treatment works. Essentially, they've come to the end of the line, and they've been on various TB treatments for the previous 5 years. And in our MSF program, we were able to start them on a treatment that hopefully would work. So they stayed with us at the clinic or next door to the clinic. They actually lived at the clinic for 2.5 years of daily treatments, really, really difficult, harsh treatments. 1 year of injections, which 90% of people lose their hearing afterwards, of which John lost most of his hearing. And it was a really constant struggle. But it's a real positive story, and a real positive story of the impact that we can have as MSF is that we were able to navigate this whole process for them. And after 2.5 years, they were actually cured of XDR TB, which is a huge, huge achievement. And this is a real success story of our TB program and what we can do in MSF. And we have TB programs like this all over the world, and very much in Eastern Europe as well, where we do a lot of operational research about the best treatments and the best way forward for TB. My next mission, as you see, was in a whale in South Sudan, and this was extremely challenging. As I said before, it was a 300-bed maternity and pediatric hospital, and it was the only hospital providing care for 1.5 million people. And it was a constant challenge, and the struggles that the struggles that you go through there in one day is equivalent to what maybe some of the really heartache and difficult stories that you would hear maybe in the NHS over 1 year. It was very, very, a very concentrated and quite a difficult experience. But we actually, within that, we do a lot of life-saving work, especially with malaria, measles, meningitis. And the really ability to MSF, really amazing ability to MSF is to adapt to what we see in front of us in these contexts. For example, I was able to run a vaccination campaign vaccinating all children under the age of 5 in this area, which is a huge undertaking, but it's a huge public health intervention, which has a massive, massive impact. And one of the cool things what you do where you get to go in MSF is actually you get to go to really remote locations around the world where nobody else will go can get to, and sometimes no other organization will work in. And in the bottom picture, you can see that you kind of have to travel in very, very light aircraft into these destinations. So you get to really see very unique parts of the world that you would never otherwise get to see. Next slide, Charlotte. And the next picture on the left is of the internment space camp I spoke about in Herat in Afghanistan. So if you can imagine 100,000 people who have fled to this area, and fled because of conflict with the Taliban, but also fled because of drought. And if you look at this picture, but if you spread this picture out over a wide kind of area of a desert, and there's 100,000 people living there, and it's your job to actually go there and think, what are the health needs of this population? So I led the team on actually doing that assessment. So it's really, really can be very complicated, but you have to go in and talk to the communities, try to understand what kind of resources they have got and what the health needs, what the problems that they are facing. And you bring that all together and you then set up an intervention. And through this we were actually able to set up a primary healthcare service, because primary healthcare is the backbone of healthcare, which is needed, especially in remote settings. If you can provide good primary healthcare, it can do a lot to providing actually basic kind of public health and basic clinical care. So that's what we set up there. And so we set up a service which was able to give primary healthcare to 100,000 people. So the impact that we had on the day-to-day health needs of the population was huge. And so that's another real success story. And yeah.
Mark, just a little note to say you've got a couple more minutes.
I'm finishing up now, one more slide. And in the other picture, you see the difficult terrain. Again, this is another light aircraft flying quite low over Afghanistan. You see the difficult terrain that we have to work in at times. So it can be really challenging to actually get into these environments. And then the bottom picture is just to show you sometimes some of the beautiful locations you get to work in as well. And this picture is taken in Chirag Zulu in Malawi, which is one of our big HIV projects. And when you do get downtime, especially in contexts like Malawi, where it's quite safe, you can spend your downtime doing hiking in the beautiful, lush countryside. So it's not all about work and difficult contexts, but you can also get to go to some amazing places and get to have these really amazing experiences. And just going to the last slide. Oh, 2 more slides. Okay, quickly, this will look like what it looks like maybe for you. So I put out a bit of a timeline, what a career for a doctor or a medical professional from in med school or nursing school now, how could it look for you? So put a bit of a timeline, maybe you could take a mission in a few years in Central African Republic, South Sudan, Venezuela, Haiti. But there's a lot of different directions that you can go in with MSF. You can work clinically, you can take a medical leadership role, you can work in leadership and epidemiology, you can work in the operations side, you can work as a specialist advisor, such as in HIV or NCDs or pediatrics. Or you could take a role in advocacy and speaking out and lobbying pharma, governments to try and improve different services that we provide around the world. So the career options in MSF is so wide, it's very difficult to put that into one slide, but you can make a career out of MSF. Moving on to the final slide. These are just a few take-home messages, and this is kind of taking on board the experience that I've experienced training as a doctor in the UK. There are endless career options in MSF, but also in global health and other organizations. And if a career in global health is what you need, if that is what you want, do it. Because don't listen to the people who put you off. I have heard statements like, that is not a real career, that last heard in February of this year by an NHS consultant, or you need to do infectious disease training followed by a PhD, etc. That's a bad idea, that is career suicide, there's no money in that. These are all comments that I've heard, and if this is what you want to do, do it. You don't have to finish medical training, so you don't have to become a consultant, or you don't even have to become like a GP or anything before you can do this. You can still have an NHS career or a HSE career in Ireland as a middle grade and do this at the same time as a global health career. One common thing I hear from junior doctors is, I need more airway experience and anesthetic and critical care experience before working abroad. You do not need that. You need general skills, so like working as an SHO in Ireland or the UK. But what you do need is an open mind, creativity, empathy, tolerance, flexibility, and knowing the limits of your knowledge. And these are the skills that you actually need. Despite what you heard, you do not need to speak French. But also you can have a normal life. You can have relationships, get married, have children, have a mortgage, but you need a bit of flexibility to actually make all of this work. And my last point is, my story is not the only way of doing this. There's so many ways, and you meet in MSF so many people who have done so many creative and different ways to come into their career path. And there's no perfect way. But I think follow what you enjoy, and within medicine, but also outside of medicine, because outside of medicine, the skills that you gain, the alternative stuff actually gives a lot to your career within MSF. Listen to the people who give you advice that resonates with you, and ignore the advice that does not resonate with you, because they're normally the people who are quite jealous of the people of when you say what you want to do. They're normally quite jealous of that, and you tend to kind of get negative feedback. So listen to the good stuff and try to put aside the bad stuff and just go for it. So that's it. Thanks, guys.
Thank you so much, Mark. That was really excellent, like really inspirational and brilliant the way you outlined, you know, the possible career paths and made it all seem possible for people. So thank you so much for that insight. We are running late, so I think what we'll do is take a break now until past. If you can come back at past, just grab a sandwich. Now, our three wonderful speakers are sticking around over the next 10 minutes at least to look for questions in the chat. So please put any questions you have there. I know there's already a couple of questions in there for you, Geraldine. But I just want to say a massive thank you to the three of you. Really, really interesting. And it's made me want to go in the field. Not sure quite how with two very small children, but somehow I'll manage it. But yeah, and three very interesting and different perspectives. So I think you'll all join me in thanking the three speakers very, very much for their contributions today. So any questions, pop them in the chat, and see you all at 12:30 to continue with the interesting, much, you know, more very interesting talks. And also just to highlight that we do have an HR session later in the afternoon with two of our HR officers. So any particular career questions you have, you can also direct to them later today. And equally, I'm sure that our speakers will be happy if you want to contact them later through me, later on after this event as well. So see you all back at 12:30. And please don't log out of Zoom. If you can, stay logged into Zoom, but just put yourself on mute. And yes, see you later.